Hello, this is Maria Monti. I am not a doctor, nor do I claim to give medical advice, treatment, or diagnosis. These segments will be covering medical information as quoted from medical doctors and other holistic practitioners in their published works, where references can be provided upon request.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail.
Hey, everybody, welcome. I get to have a conversation with Maria Monti here, who is someone that has not just dedicated her life to understanding how important it is for all of us to pay better attention to our health, but she's out there every day working with people to understand the importance for today's segment for physicians, other medical professionals to chime in on why, to your health, it's important to understand the importance of the bras we use in our lives and what that means. Today, we're looking at why recently integrative doctors and other holistic and structural practitioners have been weighing in on, for us ladies, how the bras we wear can potentially affect our health. Now, fast forward to where we are today and the world and talking about our lymphatic system, there's an awful lot we need to know. Maria, it's great to have you here. You are with the Healthy Bra Company. You are taking this message out. But this conversation is particularly important to you personally, isn't it?
Yes, it is, based on my own personal story. Would you like to hear it?
I'd love to hear it. And so would our listeners, because, fast forward, if we'd had a conversation about this 10 years ago and talked about the lymphatic system, not many people would understand much about it. But give credit to the internet, give credit to women who are paying attention, and give credit to some integrative doctors. It's a brand new conversation. But to you personally, has a different meaning, maybe.
Yes. And I think we heard about it when there's been distinct severe problems with the system in certain disease connotations, but we haven't heard about it as a preventative situation in the body where the miracle of the body being able to regenerate itself, cleanse itself, and heal itself. The lymphatic system is very important. And so what I discovered so many years ago when I was practicing as a postural therapist, I discovered foundations within my body as well as lymphatic congestion. And that, I had it checked out and everything was benign in the sense, but my body was constituting them. And therefore I needed to figure out, well, why was this happening and what could I do about it? Since I had grown up on an organic farm in Michigan with my grandmother, I learned holistic wellness back in the 60s and 70s. So I wanted that approach. And it to me, as a scientist, the fact that I had already checked out that there was not a severe mitigating issue that I was dealing with, but a constitutional issue, I was willing to use my own body as an experiment. And as a result, I looked at different modalities and started studying the lymphatic system, and I practiced some of these modalities to help me get rid of some of these cysts. Now, I had cysts in my neck, the size of a quarter and a dime. I had cysts in my groin, and I had a very deep cyst, or what the massage therapist told me was a lymph node that was inflamed deep inside my armpit, which is called the axilla area. And that was one that I obviously couldn't see, but she could palpate when she found it. And around the same time, I was getting involved in the custom fitted bra business and looking at wireless options. And the two seem to, once again, serendipitously meet up with one another in a sense that I started wearing these bras. So it was the first time in my life where I did not wear underwear. And the support mechanism for the size that I was becoming with physical changes that were happening in my body, including this systemic swelling that I didn't have a handle on at the moment. My body just needed something else. And so I thought, you know what, I'm just going to experiment with these bras and have no underwire in there and see what happens. And of course, then I had studied up and looked at lymphatic drainage as a massage. So having a manual lymph drainage therapist working with me, and also other modalities that directly affect the healing of the lymph. And within about 12 weeks, I found that the lymph had cleaned itself up, cleared itself up, and the massage therapist could no longer find the lump.
Mm.
And the ones in my neck disappeared as well. The ones in my groin disappeared as well. And so with this multifaceted approach, I thought, well, related to the bras and the underwire and the constriction of the lymph under the arms, but many other things. And so this took on a whole nother focus for projecting the Healthy Bra Company out into the world, because not only was I a postural therapist at that time and looking at how to marry the postural therapy business with these custom fitted bras, but first and foremost, educating women on the health of their breasts, the health of their lymphatic system, the health of their posture. And so being able to really take an approach for bra fitting that was not out there and much more holistic. And believe me, I'm not somebody who promotes that everybody should wear a bra. Honestly, I will tell ladies who call me, if they don't need it, don't wear it. Because believe it or not, just the subtle bouncing of the breasts, when we're walking, and the movement there unrestrained actually does stimulate the lymphatic system. But not every woman can take that approach, whether it be from, the aspect of corporate America where you must, look a certain way and be contained, or heavy weighted women, who have heavy weighted breasts. They may not be large in stature, but maybe their breasts are such they can't go without. So I feel like my personal story can be that I need to wear a bra for my own self, because if I don't, my collarbone hurts. And, I'm in the triple D range, but I want to educate women who are like-minded and like my situation, that there is some knowledge and wisdom that needs to come along with wearing bras so that you can actually protect your body and protect its healing systems.
Yeah, but this is what I love about this, because fast forward to where we are today, Maria, right? We are at a place now where women, if they are not acutely aware of the importance of the lymphatic system in their bodies, right? It's just something that is not being transmitted properly by their doctors. And you're right about the fact that integrative doctors and holistic doctors are talking to their patients about this. But number two, now with the internet, you can find out what the role of the lymphatic system is, what it does, and how it does it. And most importantly for women, we are acutely aware of how important this is. And so let's talk a little bit, if we could, about, if nothing else, a basic understanding of the lymphatic system and circulation. I think it was the last show, Maria, that we talked about the fact that I was referencing the fact that, going to see Dr. Darvish, she had one of these vibration machines that you stand on, right? I don't know what they're called.
Yes.
But they're phenomenal.
Whole vibration.
Oh,
they're whole vibration machines.
Oh, they're
they are
incredible. And, in that world, we're now learning why we have to keep our lymphatic system moving. Talk about this a little bit, if you could.
Well, I own one of those machines myself.
Oh,
so,
nice.
and years ago, before I actually got one of these, I learned about the trampoline, and the trampoline does a similar thing in the sense, when you look at the lymphatic system, it doesn't have its own pump. It is part of the circulatory system, but it requires muscular movement of the body or physical body work, or even deep breathing to stimulate the thoracic pump of the lymphatic system. So, the trampoline itself and this whole vibration machine and exercise in general, as I said, movement itself helps squeeze that system so that it actually works without having the pump.
Yeah.
Now, the thing is that you want to be able to do all of these types of exercises, but can you imagine being a large-breasted woman and getting on a trampoline or getting on a whole vibration machine and being able to do work with your free arms and not having actually to hold your breasts
Yeah.
so that they're not vibrating uncomfortably?
Mm-hmm.
You understand what I mean?
Mm-hmm.
So, yes, they do stimulate the lymphatic system, and that is perfect, and that's what we want. And the lymphatic system is something that we, on a daily basis, because think about it, we're not born with clothes on. All right, so anything that we add to our body can compress the lymphatic system. Anyone who's ever put a rubber band around their fingers knows. You leave it there long enough, you have it there tight enough, not only does the circulation get cut off and turns purple, but so does the lymphatic drainage.
Yeah.
So, and it doesn't take a lot to compress the lymphatics because some of them are very superficial toward the skin. And so you can just put pressure on there, let's say from an elastic band that may be around a tight bra. And it doesn't cut it off necessarily all the way, but it will impede the lymphatic system from flowing properly.
Yeah.
That all
Maria,
around the breast area.
Yeah, I remember, maybe you're going to help me with this, but I remember when I first started doing the show, I got to interview Dr. Christiane Northrup. And I remember for the first time in my life hearing this kind of conversation. And, you and I know that for women that don't understand the self-care for our bodies, this might be new to people listening. So your message about this is very, very important, because now where we are today is not only do we know it's important, but now we have all these doctors chiming in and saying, please look at the science now, look at the information, right?
Exactly. And she really did a great job of bringing this out there. Past, where you've heard it is from massage therapists, different other kinds of therapists, but not the actual medical doctors. I mean, I've looked at books where even cardiac surgeons are coming to the conclusion that they understand what has been happening with the lymphatic system and how it's much more important than we ever realized. But it's only coming in to the written documentation and the books that they're writing in the recent years. So, when Christian talked about not wearing an underwear wire bra, part of the reason was it's not all underwire bras necessarily, but it's particularly the ill-fitting ones. In an ideal world, and I've actually discussed this with someone in the industry, is that if you could take an underwire and custom make it so that the bra itself really is a custom-made underwire bra, and cause the wire to be formed in the shape of the woman's breast and do exactly what it's supposed to do, and not stop in an area at the side of the breast under the arm where it would cause poking in or compression. It may not be possible to do that, but if it were, that might be a better situation. But given we're not sure, she made the blanket statement about not wearing underwire most of the time because it can cut off the circulation of both the blood and the lymph around the breast, the chest wall, and the surrounding tissue. And at the very least, she wanted ladies to minimize their wearing of the bras and to pay attention that tight bras can cut off the lymph flow and make it much harder for the body to detoxify breast tissue. So I think that really makes a huge statement. And, I'm sure that anybody listening to that would be impacted by that statement because it may be the light bulb moment for some.
Well, yeah, I mean, part of this too is, and before we start to talk a little bit more about, the functional importance of the lymphatic system, I want to take a minute and just let folks know, first of all, how they can find out more about you. I want to make sure folks have a way to get a hold of you if they have questions, if they want to explore what, this incredible option is for women that they may not even know about to actually get a bra that fits. How can people do that?
So best case scenario is calling me on the phone, because I really do like to talk to women directly. That phone number in Linwood, Washington is 815-3205. And then, of course, my website, www.thehealthybracompany, all spelled out.com.
Give out that phone number one more time.
360-815-3205.
We're going to take a really, really short break. When we come back, we're going to be talking about, what you do not want to do is impair this system in any way. We're going to take a short break. Maria Monti will be right back. Not only are we going to tell you about some of the most important things you should know about this, but you should also know about what features of a bra fitting do you have to take into account when you're talking about the lymphatic system. We'll be right back.
This segment is brought to you by The Healthy Bra Company.
Calling all ladies. Are you struggling with neck, back, shoulder pain, or postural issues? You actually might have a related bra problem. Talk to Maria Monti at the Healthy Bra Company. She's a professional postural therapist who offers custom-fitted, custom-altered bras in 2,500 size combinations specific to your body type, shape, size, anatomical features, and breast weight. Call Maria today to find out more at 360-815-3205.
Hey, everybody, welcome back. Yeah, really excited to have Maria Monti joining us here today from the Healthy Bra Company, because what we're talking about is your health. And why is it that physicians and other medical professionals are chiming in on what type of bra you wear and how to pay more attention to your lymphatic system? Maria, I know this is something that is really near and dear to you, but I also want to get some information out there about, look, what do women need to know? What do they know about features of a bra fitting? What do they have to take into account when it comes to that and their lymphatic systems?
Okay. Well, let's just look at a couple of things that the lymphatic system does in terms of functional importance. So it maintains your overall fluid balance in your body. It removes impurities, waste products, and bacteria from your body tissues. It filters impurities and concentrates the fluid as it passes through your lymph nodes. The lymph nodes themselves do not regenerate or repair themselves. So that being said, means that they have such an important function in the body that if you, again, cut them off, damage them, or compress them, you impair the function. Okay. And so let's look at what, again, clothing might do. And again, it's not just the fabric content or the textile, but necessarily the design. So I actually have women bring all of their previous bras in for fitting and have them show me, the bra itself, and then say to me what was working with it and what wasn't, and what was the problem. And then as we examine their body posture, their body type, their breast type, and then there may be like red marks on their shoulders or on their breasts themselves, we talk about what the existing bra is that they've been wearing and what it's actually doing. And so we will see an awful lot of compression around the rib cage when the band has been too tight. If there is not enough support in the bra, we will see red marks, even divots in the shoulders, which can be just very slight depressions in the shoulders. And I've seen it all the way up to where it actually starts to hollow into the bones. So just imagine wearing improperly supported bras for 20, 30, 40 years, and the weight is actually starting to depress the bones. It's gone through all the soft tissue. It's probably impaired the nerve junction that goes through the shoulder. And now it's actually starting to depress the bone. And so, I look at all of these things, and if they have certain circumstances that are to the extreme, I can't change a lot of that. Okay. If you've got hollowing of the bones, you can't change that. But immediately what you can do is you can rectify the causation, meaning putting them in a bra that's actually going to distribute the weight much more effectively, and also not compress the tissues. So, and I'll just refer to this very, very briefly. Because we're going to talk about this in a future session. But that's one of the things that sports bras did when they first came out, was for the lack of a structural and functional foundation garment, they created compression. So they made the bra pretty much tight, and compressed the breast toward the chest, compressed everything you could so that there was no movement. And when you think about the fact that we are sweating and producing lactic acid and all of these toxins we're out of the body when we're exercising, compressing some of the very areas that are going to be helping with that is not a good idea. So in terms of just looking at their particular situations, and then not every woman is open to the education. They may just come to me and say, look, I want a better fit.
Yeah, exactly.
So I don't always include the education of the lymph, but I express, okay, this is how we can do better. And even if I'm not compressing and not having this hang in the wrong way, they're getting the benefits to the lymphatic system, even though they may not have asked for them or don't want to elaborate into the issue. And then one of the things that is actually done during the fitting of the bras is, and this happens with every single person because it helps the bra fit better, I teach them a manual lymph drainage under the arm, which is part of actually putting the bra on, so that you can start stimulating the circulation in the axillary lymph nodes, etc., for bra wearing women. And not only is it suggested to do it when they're putting the bra on, but for ladies who are open to the education, I explain to them that this should be done before you put the bra on, and for sure after you put the bra on, because you've been wearing it all day long. And no matter how good it is, and no matter how much better we've made the support, it is still a contraption that has been put on your body that you weren't born with, that can have some impact on the lymphatic system. We're not saying that it's zero impact. There's going to be some. So, I really do try and teach them. It only takes a couple seconds to start manually stimulating the lymph nodes, the lymph vessels, and the lymph tissue underneath the arms and in the breast tissue. And if they're willing to go one step further, I talk to them about skin brushing, which is something that does that as well.
Well, I think, and part of this, we started talking about this right out of the gate, about to your health, why physicians and other medical professionals chime in. And so as part of this, we also want to get back to some of the things you said earlier, which is, look, there are things that we have to worry about or think about when it comes to the function and the importance of the lymphatic system. Because folks might be thinking, why do I have to pay attention to, how important is the lymphatic system? And so your example of your personal journey, you talked about, what happens, everything from swelling to infections. But from this point of view, isn't there very specific reasons we should keep our lymphatic system healthy?
Absolutely. I can quote one medical doctor who said that the lymph node acts like a trapping infection.
Yeah.
Okay, imagine that if that's not working. That is a situation that actually, there has been a term quoted as being called auto-intoxication. So imagine if the body, the system that is set up throughout, and it is everywhere throughout your body, is impaired, is dysfunctional, then it can't do its job. So it's almost like if you were going to imagine you put your garbage out on the sidewalk for the garbage truck to come and take it to the waste station.
Mm-hmm.
Well, either, let's just say somewhere along the line, the end result does not happen, that your garbage never makes it to the waste processing station. It can be that traffic was slow and it wasn't flowing properly. It could be that there were detours, or it could be that there was a complete standstill in the delivery system of that waste to the waste treatment plant. If that happens in your body, that's where we set up a situation where, and this is going to kind of sound gross, but where the toxins sit and fester, putrefy, clog up the whole system, and we get sick, and the body starts to show it in certain places. So in my case, I had it more in the neck and the upper body,
Mm-hmm.
my neck and my armpit areas. And, prior to this time, I did not know very much at all about the lymphatic system. And so it made sense to me as I was discovering, what might be affecting the lymph nodes and making them overload in that particular area. Okay, and I don't really need to go into that because that's a whole.
But I think what you're saying is, fast forward to where we are today, and what women are learning a lot about is how to take better care of their lymphatic system, period.
True. Yes.
Right.
And that's part of why I do what I do for a living.
Yeah.
This education.
Well, I think, I think we haven't really stopped long enough along the way sometimes to really think about all of the things in our modern society now that can affect us positively and not so positively. I mean, one of the things we now know is lack of movement, right? Lack of movement, and what the effect of lack of movement is now. And yet at the same time, if we're not mindful of what, not having proper support system is about, we can also set ourselves up for a situation. And these are the things that you are really involved in, not just as somebody that really cares, but from a science point of view.
Have you heard the new adage recently where they said that sitting is the new smoking?
Yeah, I did actually.
That directs its attention right to lack of movement. And unfortunately, as you said, with the wonders of technology and time-saving devices and everything, we have, as a culture and as a world, become perhaps more inactive physically as we become more active mentally and socially, but sitting, you know what I mean? And so a lot of the women, when they come in, and I go over their ergonomics. I say, what are you working on all day long? What is your job? What are your positions of your job? And, the majority and having commutes in their car. So immediately what you're ending up doing in the lower body is cutting off the lymph system through the groin, in the pelvic area, unless you're getting up repeatedly to move around and stimulate that. You're not really deep breathing. You have to obviously be shallow breathing, but we are losing the ability for the deep thoracic duct and the diaphragm to be doing its job. And then, of course, if you're in an ergonomically compromised position, you've got rounded shoulders. Then add the weight of the breasts if you don't have a good supporting bra, or even if you do, and then multiply that by the number of hours sitting there, and you've actually compressed the lymphatic system and caused yourself, to basically be through those hours of sitting. And one of the things that it's related to me when I was thinking about how they tell you to get up in an airplane, and walk around for long flights. It's not just blood clotting. That's what they talk about specifically. But when you think about the lymphatic system, it is the same situation. Is you may not have a direct result that you can put your finger on, but you are compromising the lymphatic system by that long-term sitting.
Wow.
And
This is a lot. This is really a lot. I love that we're doing this, and I know we're going to keep doing another show. But I think that the most important thing is people can call you. Let's give out your phone number again.
360-815-3205.
And let's have the website for folks.
www.thehealthybrocompany, all spelled out.com.
Awesome. Maria Monti, everybody, we're not done. We're going to take a shorty. We'll be right back.